Indeed, every illness, whether it's mental or physical, begins in the digestive system of the human being. GAPS, gut and psychology, and gut and physiology syndrome establish a connection between the state of the gut and the health of the rest of the body. If you take the gut of an adult and put it flat, it will cover a tennis court. Some researchers say a football field. Majority decided that it's a tennis court. Recent research has discovered that 90% of all cells in your body is your gut flora. 90%. They protect that tennis court from any invader from the outside. Be it a microbe, be it a worm, or be it a toxin, a chemical. They do not allow these things to go into your castle, into your body. They protect you. If it is a chemical, if it is a cancer-causing chemical, if it is a toxic metal, or it is something else, these microbes have an ability to neutralize these chemicals. In fact, they are the best neutralizers and detoxifying substances on the planet known to us, microbes. Healthy gut flora has a myriad of microbes in it, and all of them plant each other, harvest each other, eat each other, control each other, cultivate each other. They're all controlling each other, so not one of them can overgrow, get out of control, and start causing damage. We take antibiotics, what do? We kill off a large part of that harmony. So what's left there suddenly is not controlled anymore. So various things overgrow, and we have disharmony. We have an imbalance. As a result, your food immediately gets digested in a very different way. Not the way you used to digest it before the course of antibiotic. We live in a world where antibiotics are prescribed to us on a regular basis from a very young age. On top of that, most industrial food that we put into our mouths is full of antibiotics. Meat, industrially produced, fish, industrially produced, eggs, milk, vegetables, fruit, grains, beans, everything is grown with substances which have antibiotic properties. Most pesticides are antibiotics. So every time we're eating non-organic foods, we are taking in antibiotics. You all know that we need B vitamins, right? B1, B2, B3, B5, B6, B12, biotin. The major source and the most important source, and quite often the only source for us of these vitamins, is our gut flora. Because they're so vital for us, Mother Nature gave us our own little factory inside our digestive system, which is constantly producing these substances and constantly releasing them into your bloodstream and into your lymph. And there is a very interesting conversation going on between the body and the gut flora. When the body will tell the gut flora, I need so much B12 right now, and the gut flora will release it in that amount. We can never repeat that with any supplement, with any food, with anything. When people destroy their gut flora, usually with antibiotics, what happens to them? They develop anemia, first and foremost. They become pale, pasty, their energy goes down, and they can't tolerate stress and pressure, these people. That's anemia. And this person will continue being anemic until we restore the gut flora of the person. That is what has to be done. What can damage our gut flora? Can any of you raise your hand if you've never been exposed to at least one of these? Contraceptive pill, I would like particularly to single that out, has a devastating effect on the gut flora. And our ladies take them for quite a few years before they're ready to start their family. Why is that important? Because the baby gets its gut flora from the mother when the baby goes through the birth canal. At the moment of birth, the baby swallows mouthfuls of bacteria that live in the mother's vagina. Where does vaginal flora come from? From the bowel of the woman. So if the woman has abnormal gut flora, she will have abnormal flora in her birth canal. And that is what she's giving her baby from the first moment of the baby's life. Abnormal gut flora. In my clinic, I worked with thousands of autistic children. Almost 100% of mothers have abnormal gut flora. I had about a handful of moms who didn't seem to have that problem. In every case, the father had a severe abnormal gut flora. So that is where this flora came from in the child. Depending on how much toxic load the baby is born with, the constitution of that baby is stronger or weaker. A growing percentage of our babies in the Western world are born with a huge toxic load, and they get abnormal gut flora from their mother from day one. So these children already have a very compromised constitution. By 2020s, between 20 and 25, in the English-speaking countries, we'll be diagnosing one child in 2. Half of our babies will be autistic. And that graph is not going to stop there. It will continue growing until majority or maybe all children will be autistic in the Western world. If that is not a catastrophe, I don't know what is. And our governments are just putting their heads in the sand. They don't want to even recognize this fact. What do we need to do with this child? We need to change the gut flora. We need to heal and seal the gut wall. Close all the holes in the gut wall so toxins stop absorbing. And once that source of toxicity stops, the brain cleans up. Human brain has a beautiful ability to clean itself up. It has its own detoxification system, microglia. It will clean itself up and it will start functioning. The child will wake up. The toxic fog disappears, and from that moment on, the child learns. So if the child is 2 years old, 3 years old, we can pull the child out of autism 100%. I have lost count of loving parents who call their child a zombie because of anti-epileptic medication. The child's personality goes, it's a different person, they become couch potatoes, and they can't learn. They develop learning disability as a result of the medication. My dream is that one day our doctors will be putting them on the GAPS diet instead of on medication, these children, first and foremost. And in a large percent of them, the seizure will never happen again. GAPS people have abnormal digestive system, unhealthy digestive system. It doesn't produce enough serotonin. It doesn't produce enough dopamine. Sometimes produces almost none. So these children were depressed. What is depression? Clinical depression. Not enough serotonin, not enough dopamine. That is what depression is. So these children grew up being depressed most of their life. Morphine, heroin, cannabis, sniffing glue, dangerous, reckless behaviors, unsafe sex, and other stressful things like that, they can produce that fountain for a few minutes for the brain. For the first time in their life, these children realize that's what life is about. And they want it again. And who can blame them? And that's how they become drug addicts. That is where addiction comes. In order to help these children, we need to heal their gut. That's where we have to start. Autoimmunity. All autoimmunity is born in the gut. Every autoimmune disease is a digestive disorder, whether it is rheumatoid arthritis, or lupus, or psoriasis, or multiple sclerosis, or amyotrophic lateral sclerosis, or anything else. Our major immunologists in the world now are confirming this fact in the last few years. Any autoimmune disease, if you've been diagnosed with any autoimmune disease, whether you have digestive symptoms or not, go to your gut. Focus on healing that. Focus on normalizing your gut flora. And you will change the very basis of your immune function in the body, and the immune system will start working properly in the body. Most GAPS people have feeding problems. Majority of these children and adults are fussy eaters. It usually is a first sign of GAPS. It is a symptom of abnormal gut flora. If your child is fussy with food, your child has abnormal gut flora. It isn't normal for a child to be fussy with food. Why? Because these children have solid physiological reasons for this. More than 90% of children with learning disabilities have this problem. And they limit their food to sweet and starchy foods. They will eat bread, they will eat breakfast cereals, they will eat chocolates and sweet yogurts and banana maybe, but all the proper meals are excluded. These children are drug addicts. There's no other way of putting this. They are drug addicts. The drug is produced in their digestive system by their abnormal gut flora. In order to pull them out of this vicious cycle of drug addiction, parents have to work together. It is possible to do that. Thousands of children have done that. They have to work together, and I have a chapter in my book which is called It's Feeding or No, where I describe how to do that. How to get your child out of that drug addiction. The drug is sugar. The drug is wheat. The drug are those biscuits and cakes and crackers that they're eating, and breakfast cereals that they're eating. The most important part of that program is the diet. Because it is a digestive disorders we're talking about. Your digestive system is a long tube. What you fill that tube with has direct effect on its well-being. So diet has to be the #1 treatment. These are the foods we avoid because they are very difficult to digest. Human digestive system, in fact, has not been designed to digest them well, and we get virtually no useful nutrition from them. These are the recommended foods. That is what we're actually eating on the program. These are the foods that human digestive system can break down well, and they are the basis of building our human bodies. Meat and fish stock provide glucosaminoglican, provide those sugars that Lucas was talking about, provides glucosamine, collagen in large amounts, gelatin and other things. And these substances happen to be what the cells in your gut wall are made from. These foods provide all the necessary building materials for your gut wall to give birth to trillions of new cells. In that way, it rebuilds itself. Fermented foods is something that human beings ate for all of our existence on the planet. They are not optional for human beings. You have sauerkraut in Germany, wonderful food. Make it at home, because commercial sauerkraut is not the same. Grow your own cabbages, make it at home. The only fat suitable for human physiology is animal fat. Vegetable oils, cooking oils are poisonous. Nobody should be eating them. Nobody should be cooking with them. We will work on restoring your child's detox system, because in all these patients, the detox system is broken down. Once the detox system recovers and starts working, it removes these things out in ways that our science hasn't even discovered yet. It's an extremely powerful system. In more than 85% of these children, when we retest a year later, metals are gone, and we did nothing about it. Lead is gone, mercury is gone. We didn't have to chelate. We didn't have to do anything about it. You can start from the full GAPS diet. Full GAPS diet gives you longer list of ingredients to play with, and you can eat out. You can eat in good quality restaurants while on the full GAPS diet. And then later on, you will achieve a lot of healing on the full GAPS diet. Many people recover completely just on the full GAPS diet. But if you have some symptoms which are just not going, you achieved a lot of healing, but something is just still there behind, it's a good idea for you to get organized, get some time for yourself, and do the introduction diet at home, and you will get rid of those remaining symptoms.